all. My name is George. I'm one of the trainer with British Academy. Now, today's video would be about the basics of OET writing. In this video, I'll try to explain you step by step how to write a letter. So I'm going to give you a kind of a structure which will help you to write it in a simple way, and it will make it more easy for you to understand what OET letter is all about. Now, this structure is just one of the way to write a letter. You can use your own structure. You can place your information according to what you feel like, which paragraph you want to keep the information, but make sure it should be relevant information what you take based on the target reader's point of view. Also, the placement of paragraphs needs to be appropriate because it should not hamper the flow of the reader. That is something, these are the certain topics which we are going to cover in this lesson. Now I'll share a white screen, and on this white screen I'll try to explain step by step how to do this OET letter. Now let's see towards it, see how we can do this. I'll just share the white screen. Here we go, explaining your things. Now let's understand, first of all, what is the timing, the time limit, what is given to you in OET writing. The total time which is given to you is 45 minutes, okay? In this 45 minutes, it is the part is divided into two parts. The first is the initial 5 minutes, which is called as the reading time, wherein you're not allowed to write anything. You just have to make sure you make point and you read the letter and just understand. They will not allow you to touch your pen. You will not be allowed to write anything on your question paper or on your answer paper. You're just allowed to read and plan it. So I'll also teach you how to plan this initial 5 minutes, how to plan it, and how to organize your letter before you begin actual writing. Okay. Then you have the remaining time, that is 40 minutes, which is considered as writing time. Okay. Now, so in this 40 minutes, you should be able to write a letter, a complete letter, which provides all the information about the patient, but that should be relevant to the need of the case note. That should be relevant to the point of view of your target reader. This is something you should be very clear. Now, let's understand what are the types of letters what we have in OET. First one is a discharge letter. Then you have a referral letter. Then you have a transfer letter. Fourth one is the last, that is advisory or information letter, which is very rare, but still it's good to know. Information letter. Okay, these are the types of letters which has been asked in your OET examinations. You should be prepared with it. Now, the word count. Now, they expect you to write to an approximate length. The word count which is required in OET letters is 180 to 200 words. Now, please be advised that if they're saying that there is a word count what is required 180 to 200 words, which doesn't mean that someone is going to sit and count your words. It is an approximate length what we need in your OET writing. So just be relaxed. Nobody is going to count your words. If all the points are relevant, and if you go beyond 200, there is no markdown. If you go beyond 200 or below 180, nobody is going to mark you down if all the relevant points are taken in the letter. Please be rest assured about it, but your assessor is going to count the information what you write in your letter. They would be saying that did you take all the relevant information which is required in an OET letter. Okay. Now let's see what is the structure that you need to follow when you write OET letters. Now, what I'll do is I'll divide the entire letter into 13 equal parts so that you're very clear which point has to be placed where, keeping the information in your mind that you have followed the appropriate structure and also you have presented the letter in a much better way. Now, the first point, if these are rare letters, I see this. Official letters, it's not often that they give you the hospital where you're working, the name of the hospital where you're working. But I've seen some unofficial letters, they state or they mention the name of the hospital where you're working. If it is given, it's better to write in the first point. That is name of the hospital where you're working. I'll just type it over here, hospital where you are working. I'm doing this so that if you wish to take down notes, you can take down notes while attending this lesson. Leave one line. Second point is name of the person to whom you're writing. Name of the person to whom you're writing. Third one, without leaving any line, designation of the person to whom you're writing without leaving any line. Fourth one, address of the person to whom you're writing. Now, after this, now in the address part, please make sure punctuation is not required, no punctuation required. Even if you don't put any punctuation, it's completely fine in the address part. Leave one line, the fifth point, that is your date. See, some people do write date as the first point, even that is completely acceptable. There is no markdown, as I said earlier. OET does not have a fixed structure. They just want you to pick up the relevant information according to the demand of the question. You should be able to elaborate the information and place the information appropriately where it is required. Now, the fifth one is the date, where you would write the date. The format of the date, it's better to present in this way. Like, for example, it's 23rd January 2020. So you'll write 23, the month you will write it words over here. This is a better format to write 2020. Okay, after this, leave one line. Sixth point would be your subject, that is your reference. So either you write RE, you write REF, both are fine, no problem with that. This will always be patient's name or age. Okay, for example, Mr. John Smith, comma, age at 86 years. This is also fine, no problem with it. Leave one line. Seventh point is your salutation. Now, salutation is like if you know the person's name. For example, the second point over here, name of the person to whom you're writing. The name of the person is Mr. What should I say? Thompson Peter or Thompson Smith. For example, the name of the person to whom we are writing is Thompson Smith. If we know the person's name, I would write, Dear Mr. Smith. Or if I don't know the person's name, it's better to avoid the designation, Dear Nurse, Dear Doctor. That is acceptable. There is no markdown for that. I'm not discouraging that. There is no markdown. Better way to write is Dear Sir or Madam if you don't know the name of the person to whom you are writing. After this comes the eighth point. Now, please understand, eighth point is your first paragraph. Now, first paragraph is called as overview, which means it gives an overall idea of the letter. The reader, after reading your first paragraph, your reader should understand who is the patient, which you've already written in the reference. You should be able to identify the patient. You should be able to identify the problem or the prime diagnosis, and you should also get to know what is the reason for writing this letter. The purpose should be written in short in the first paragraph, so the reader is very clear what is the reason of your writing. So this first paragraph would require three information. First is, who is the patient? Who is the patient? So I can write it this way. I'm writing in reference to the above mentioned patient. Above mentioned patient, or you write, I'm writing to introduce Mr. John Smith, the 86-year-old man. Even that is fine, no problem. Okay, who's the patient? Second one, what is the diagnosis? So I would say he was diagnosed with multiple sclerosis followed by renal failure, for example. Followed by renal failure. Okay. After this, third information what I need in this first paragraph is, what is your purpose? Now, the purpose, I would say you can write it this way, like I can take the person's name, the patient's name over here if you want. Otherwise, you can just join it together and you can write, and you would require the further line of treatment and management from your facility. And you close it. You put a full stop over here. So this is how you will write your first paragraph. So if you join it together, I'm writing in reference to the above mentioned patient, comma, who was diagnosed with multiple sclerosis followed by renal failure, and you would require the further line of treatment and management from your facility. You're done with, you have identified the patient. Above mentioned because in the reference, you've written the patient's name and age. Diagnosis, we have taken the prime diagnosis or the prime complaint what patient had, we have taken that. and the purpose is like what he needs. Now, what kind of treatment, the description of the treatment, and the management, what we need from the target reader, we would write it in the fourth paragraph. Okay. Now, my reason for taking this on the white screen so that you can definitely take down notes for it, and if it helps in any way for your preparation, I would be happy for that. Okay. Now, let's move on to the second paragraph. After 8th point, you will leave one line. I'll just erase this because I need some space to write. The 9th point is your second paragraph. The second paragraph is nothing but this is called as initial health, or I can call it as initial event. Now please understand, initial health or initial event, which means this para will involve any medical or social or personal history of the patient. So any event which is related to the current diagnosis. Now, this also I will just write it like this para will involve any medical or social or personal history of the patient which is relevant to the current condition. You should see that if the current condition what patient is suffering from, if the information what you're taking from the case note, it should be relevant. Okay, so please make sure if you are putting up some information in your letter, it should be useful for the target reader so that he can use this information to provide a better treatment. Okay, so this para is all about the history of the patient. Also, sometimes you may see that along with the prime diagnosis, you may also see some associated symptoms. So you can write this para will also involve any associated symptoms present at the time of admission. So at the time of admission, if you feel any associated symptoms like rashes, fever, if you feel that is important, I need to inform. Any associated things along with the prime diagnosis, if you found anything in when he was presented to you in the hospital, that should be put in the second paragraph. Second paragraph is all about initial health, which means history, or initial event, which means some referral letters you may find multiple dates. So the initial visit, like the first visit which he made to your clinic, the first visit he made to your hospital, if those informations are there, those informations will come in the second paragraph. Then you have the third paragraph, 10 point. That is your third paragraph. I'll leave one line. Third para. Third para is called as recent treatment or progress. Now, or it is called as recent event. Now, what do I mean by recent treatment and progress? Means this para will involve any treatment which is provided recently during the stay of the hospital, or like patient is stay of the hospital, or I can say, like, see, what this para means is whatever has happened the most recently. Now, if you're writing a discharge letter, in the recent event paragraph, what you would write is once the patient was admitted to your hospital, after his day was there in your department, during that stay of the hospital, what all kind of treatment you have given, what kind of response he has given for that treatment, any incident which happened when he was there with you in the hospital, all those informations you will write it in the third paragraph. But recent event means like if you're writing a referral letter with multiple events in the recent event, the most recent event which has happened with the patient, maybe the last visit or maybe the today's visit which patient has made to your clinic, all those informations you will write in the third paragraph. Now, for example, if the patient is there in the hospital, the most common examples are weight gain or weight loss, or you can say recent events like fall or bed sore, which is very common with ICU patients, bed sore, or any change in blood markers, or any recent transfusions. In many case notes, you would see patient underwent a surgery, and then later you can see the patient's HB drop. You have transfused 3-pack of RBC, 4-pack of RBCs. So any recent transfusions like blood or platelets or cryos. So anything as such you have done for the patient, all those information will come in your third paragraph. Now, I'm still telling you, keep the structure in your mind. At the end of this lecture, I'll tell you where to place the information based on which situation. This is something very important. 11th one is your fourth para. I'll leave one line, fourth paragraph, which is called as future request and recommendations. Future request and recommendations. Now, the fourth paragraph will be all about, so this is something we call it as purpose elaboration paragraph. So this para will involve any orders which has to be carried out by the target reader or by the patient himself. By the target reader or by the patient himself. So any orders which has to be, like for example, the patient is going back home, you're giving a discharge over to a private nurse or maybe to a GP or maybe to a healthcare worker who will be taking care of the patient. So anything which that healthcare worker has to do for the patient or the patient has to do for himself in future once he is out of your care. All those future requests and recommendations or the purpose elaboration, what we need from the target reader, you will go to the fourth paragraph. So this para will involve any orders which has to be carried out by the target reader or by the patient himself. Example, any follow-up visit which the patient has to do, any future blood test, any recommendations you have, like you assess the patient had a fall, you assess the patient and you suspect the patient has got intracranial pathology. So any recommendations as such you have for the patient's condition, you would mention in the fourth paragraph. Okay, or the purpose elaboration, what you need in fourth paragraph, what you need from the other person. All those future requests and recommendations will have any recommendations like an X-ray to be done, a CT scan to be done. Those informations will come in the fourth paragraph. Then leave one line. 12th point is your fifth para. So I'll just erase this and I'll write it on a new page. Fifth para, leave one line. This is your 12th point. Fifth para. Now fifth para is nothing but closing. Now in closing, what happens is you just close your letter. This is just a closing. Now I would just write, if you need any further, this is one of the way. Okay, you can put your own way. It would be greatly appreciated if you take over this case. And if you need any further clarification, please do not hesitate to contact. Clarification, please do not hesitate to contact me or my department. So whatever way you write, both the ways it is fine. Contact me or your department, whichever way you want to write it. This is just a closing. You can use your own style. I'm just giving you some examples to make it very clear and easy for you, so that you don't go through complex lectures and when you get confused, how should I pick up information? By end of the lesson, I'll also show you how to pick up information, how to read a case note. So make sure you watch the video. 13. Now, after this, leave one line. The 13th one is your, so actually this 12th one is your conclusion para. It's not closing, conclusion. I'll just change it. Please correct it. Conclusion. And 13th one is your closing. Now, closing can be if you know the target reader's name. You will write yours sincerely. S will be small, no apostrophe in yours. Yours sincerely. I'll just write it in bracket. Target reader is known. Target reader is known, which means I know the person's name to whom I'm writing. The second form of salutation, so the closing, the conclusion is, if you don't know the person's name, it would be yours faithfully. Yours faithfully. Here also I'll just write it in the bracket so that you're very clear. Target reader's name and gender is unknown. We only know the designation. Okay, target reader's name is known, where we know the person's name and gender. In the salutation we have written, dear Mr. Smith, and in the closing you write yours sincerely. When you know the person. When you don't know the person's name, it will be yours faithfully. Then leave one line. 14th point is your designation. If you're a nurse, write nurse. If you're a doctor, write doctor. Simple. Okay, this is how you need to write your letter. These are the 14 points which I wanted to guide you. I believe that things were pretty easy for you. If you have any more questions about this writing, if you have any more questions about the topic what I've covered, you can definitely comment in the comment box. I will make sure I'll answer you as early as possible, and I'll try to help you the maximum way I can do it. I'll definitely help you with all your questions. Okay, now let's understand. Now since you understood this, now let's understand how to identify, how to place the paragraph, because most of the candidates do tell me that in some letters I see The social history paragraph, the medical history paragraph is the third paragraph. I see the second paragraph as the most recent event. It depends on the situation. What kind of letter are you writing? Now take a fresh page from the center of the page, fold it, and make two columns. In the first one, you write normal discharge or referral letter. Normal discharge or referral. Second one is an emergency letter. That is emergency discharge. No, there is no emergency discharge. Emergency referral or transfer letter. Emergency referral or transfer letter, which means that there can be an emergency situation. Patient had a fall, patient is unconscious, patient has got seizures, patient has got myocardial infarction, stroke, these kind of emergency situation. Now, if it's a normal discharge letter where the patient is completely well, there is no life-threatening situation. Keep this in mind. Life-threatening situation. If there is no life-threatening situation, the paragraph structure would be same as we learned. The first one would be overview, where we need three informations. Second would be about the initial health. Third would be about the recent event, that is what has happened most recently. Fourth one would be about future request and recommendation, that is your purpose elaboration, and fifth is your conclusion. Okay, but if you're writing an emergency letter, the structure would slightly change because you're writing into a letter most of the time to an emergency department wherein a doctor would be reading the letter what you're sending, the target reader, and he needs to plan the treatment as early as possible because the situation is emergency, it's a life-threatening situation, patient may lose his life. So in those scenarios, your second paragraph will not be about the initial health, instead it would be about a recent event, what has happened today or what has happened the most recently which has caused this trouble what patient is suffering now, so that they can plan the treatment and later he can read the history of the patient. So your third paragraph will be about initial event. Fourth and fifth remains the same, there is no change. Your fourth paragraph will elaborate in detail what is your purpose of writing this letter, what kind of care you need. In short, you would write it in the first paragraph which says who's the patient, what has happened, and what is the purpose of writing this letter. Recent event describes what has happened the most recently with the patient. So you'll be able to do that. Then comes the history and then comes the purpose elaboration. That is future request and recommendation again. And the last one, fifth, is conclusion. Okay, so this is how the placement of paragraph change according to the demand of the question. So purpose elaboration is saying nothing but future request. So you should not have any confusion in this. Future request. Okay, this is how you should be able to write your letter. This is how you should be able to formulate it. There's something I want to say. I believe this was pretty clear. It was very easy for you to understand. I did not complicate it much. I tried my level best to put it as simple as possible so that you guys can get it very easily and be very simple. Now, the last part of this lecture is how to read a question paper. How to read a question paper. Now, when a case note is given, I'll show you a live example as well. When a case note is given, how to read it. Now, the first step, they give you initial 5 minutes. So, how to read and plan the question paper in initial 5 minutes. Let's plan that. Now, in the initial 5 minutes, what you should do is, you should quickly read. The first step is read the first 5 lines. Okay, by reading the first 5 lines of the case note, you will get to know who is the patient, because normally the patient's name is given at the top of the letter. Who is the patient? His age. You can check with any letter, any case note you pick up and see, you'll be able to find it. You will get to know who is the patient, what is the age. You may also get to know your position, because normally the first opening statement of the letter would be you're a charge nurse working in the so-and-so hospital. Mr. Benjamin Smith is a patient of your ward, your department. This way openings you will see. You'll also get to know what is your position. Then don't read the rest of the letter. Directly go to the last event or the last page, you can say the last page of your question paper. Read the last 7 lines or 5 lines or the last event which is given to you along with your writing task. Writing task is your question. So read the writing task and read the last 5 or 7 lines of the question paper. With this, you will get to know what is the current situation. You will understand what is the current situation of the patient. Most probably, you will also get to know what is the current diagnosis as well. You will get to know who is your target reader. Who is your target reader? Who is your target reader? You will also get to know what is his position, target reader's position. Target reader's position. Okay, now by getting this information, who is your target reader, current situation, diagnosis, target reader's point of view, that is the position. Once you understand the target reader's position, you will be very clear like what is his point of view, what kind of information I need to pick up from this case note. Things will be very easy. Now, let me explain you how to read the case note as the technique what I've told you, reading the first 5 line, last event, and the reading task. I'll show you a question paper and I'll make it very clear to you. So here we go. This is the question paper. For example, we can take this up. I'll just take the annotation ready so I can explain you how we can do this. Now, for example, if this is the question paper, what you got? So by reading the first 5 lines, the important information what you get over here is you will be able to understand whether is there any present day which is given. You'll also be able to understand what is the patient's name, patient's age. You also understand her profession, like what she works at, which may not be relevant if you're writing it to a medical professional. But from the first 5 lines, you got to know like she's married, got 3 children. This is a name, her age, also the present day, which is given over here. Now, after reading the first 5 lines, go to the last event, which is given in this question paper. Now, if you go to the last event, we get to know over here, by reading the last event, we get to know biopsy result shows moderately differentiated invasive ductal carcinoma of left breast. So we know that patient is suffering from breast cancer. Also, we know that the second point says patient asked to be operated by breast surgeon Dr. Ala Omar, who had been operated on a sister before. So we know that we are writing because the patient is suffering from breast cancer, which is invasive ductal carcinoma of the left breast. So we got to know what is the diagnosis. We got to know what is the purpose. Now we are writing it to the same person. If you see the writing task, write a referred letter to the breast surgeon, Dr. Ala Omar. So we get to know who is the target reader. We know what is the diagnosis. We got to know what is the patient's name. Your first paragraph can be formulated. Also, you know what to be done in these scenarios when you get such kind of case note. What should be done? Things becomes very easy. This is one of the way to read the case notes with multiple dates or with multiple events, or even in a plain discharge letter, you can read this. This will really be helpful for you. So I believe this technique really helped you to learn how to tackle any kind of question paper what you get in OET. I believe I made it simple for you to understand. If you have any more questions in terms of reading, in terms of writing, listening, or speaking, any module, you can message in the comment box and we can help you. You can get in touch with us. I'll leave my contact number in the comment box. You can contact us and we will be there to help. Thank you so much for joining in. Have a beautiful day.